CHADSVASC versus ORBIT. Here's the difference between the two and their use in the management of AF. Patients with AF are at risk of a stroke because of the poor contraction of the atria, causing blood to pool and potentially form a clot. So these patients must be considered for anticoagulation. CHADSVASC calculates the risk of stroke in AF patients. It has 8 components which consist of different risk factors. Once you've totaled their score, men and women with a score of 2 or more are offered anticoagulation. Men with a score of 1 or more are considered for anticoagulation. And women with a score of 1, just for the sex category, and men with a score of 0 aren't offered anticoagulation. Anticoagulation does reduce the risk of stroke, but it also increases the risk of bleeding, which has its own complications. ORBIT is used to identify patients at high risk of bleeding and can be used in conjunction with CHADSVASC. There aren't formal guidelines on how to act on the ORBIT score, but it produces a table which can act as a guide.